Hi, I'm Dr. John Young with Foundational Health Center here in Largo, Florida. And today, I've been really looking at this. We have, here in Florida, we are known for having older people, but it also happens in younger people. But this whole stroke problem, I see a lot of people that have had a stroke. They come in and it's just basically, you're just kind of watching them and hoping they get better. And so it was really very interesting a few years ago when I did some research and I found out that there's some other different ways of maybe treating strokes, whether they're new or old. If you have a stroke, and as an ER doctor, I had to deal with this all the time, you know, the patient will all of a sudden, let's say the left side doesn't work or they're slurring their speech. You go to the ER, they draw blood, they check your heart, they do a CAT scan to see, you know, what's going on. And if you get there within a certain time and the scans show everything's fine, they can actually give you a drug that breaks down the clot, and most time you're perfectly fine. Most patients, though, don't get there within less than 6 hours or whatever, or they do the scans and nothing really shows up, but they've got this stroke. And so kind of the protocol is, you know, you do the blood work, hopefully they don't have high cholesterol, you do an ultrasound of the heart to see if the heart could have had clots that shot to the brain. They check the carotid arteries to make sure they don't have clots, which could have ended up in the brain and blocked off the blood pathway in the brain, so you have a stroke. And they do that, and for a large percentage of them, we don't find anything. And so the patient then is admitted, you watch them, do some blood work and whatever, and then once they're stable, if they're perfectly recovered, great. But let's say they don't recover, or they still have a bad deficit. They can't speak, the right side doesn't work, whatever. Those people will be stabilized in the hospital, sent to the rehab, and you'll do rehab for a couple of days, a couple of weeks, a couple of months to try to get your life back, mobility back. And then they watch you for about 6 months to a year, and if you're not better after a year, you're kind of like, well, this is what you're left with. And I'm saying today that, listen, that does not have to be true. I had a fellow that, a patient of mine I've known for years, was up north, had a stroke, partially blinded, right side didn't move, and came back 6-7 months after the stroke. And, you know, he hadn't really recovered at all from the initial insult 6-7 months earlier. So there's been some interesting looking at some drugs that we use every day for some of the some other chronic diseases that have worked very well if you know how to give them. So I gave them this drug, and it wasn't instantaneous. But the next day, his vision was back, his right arm, right leg moved perfectly, and basically he was back to being a carpenter. And it's very interesting because when I was in training, and still nowadays I think this is the way neurologists and doctors think, is that when you have a stroke, one of the arteries is blocked off. And from that blockage, everything there on out doesn't get blood, and you have the stroke, the dying of the tissue. Well, there's some new ideas out there that may be true, but there is collateral circulation in the body, in the brain. And so what these people have said is maybe it's just a big inflammatory process. So doctors have thought about that, gave him steroids, but really nothing ever happened. So by using a drug called Enbrel, they found that there's a very good chance, probably 70, 80% chance, that if you give this, you can get a reversal of the stroke or partial reversal of the stroke. Whether it happened 10 years ago, a week ago, it really doesn't matter. Because this drug seems to work somehow in the brain to stop the inflammatory process. I had a lady that had a severe stroke. She was the wife of a patient of mine, and she was in the hospital actually for weeks, didn't think she would ever live, and they got her stabilized, sent to rehab. I saw her. First of all, I couldn't understand a word she said, and neither could the husband. And I heard a few words, but they were nothing with the questions I asked. Completely out of it. Bedridden, totally bedridden. Needed a feeding tube. Just one side was completely paralyzed, but just basically a complete demented woman. And I told the patient's husband what we could do to try to reverse this. And he said, well, let's do it here in the rehab. I said, the rehab place is not going to allow us to do this. So he got the hospital rehab hospital to release her. I gave her the treatment, and I said, listen, please, you cannot say anything. Now, this is a family that lives out of the area, out of state actually they live, and so when he took her back out of state to the rehab hospital, I said, please don't say anything. He did call me, and he said when they saw her the next day, they were so pleased with their therapy, how it's worked so well that they've never seen a patient heal this quickly from her stroke. Now, that one treatment got her mentally back, her memory back. We had to do another one a few months later, and she got more movement and so on. But there is in American medicine, unfortunately, this idea that you follow the protocols. And this drug is not part of the protocols. It's an off-label use of this drug for something else, for strokes. And so I'm just really passing this information on to folks to say this, that if you or a loved one has a stroke, you can do everything that the neurologist says, and if you're happy with the results, great. But if you're not, there are other options that you may want to consider. And that's why I say feel free to call us or contact us at any time. But it has been wonderful and really exciting to see patients that were given no hope, and now they have a tremendous future ahead of them. We'll talk to you later.